Tramadol facts on the controversial drug. Tramadol is a narcotic pain reliever, and it is used to treat moderate and severe pain. It is a drug that needs a prescription to obtain and is available in the form of fast-acting and extended-release tablets. Tramadol is a drug that must be controlled, which means that it can only be used under the supervision of a doctor. In today's video we will talk more about Tramadol and why all this controversy about this drug, and does it really have risks and causes addiction? In addition to the appropriate doses for each person according to age and health status. We also display its symptoms and side effects. Some important warnings about Tramadol. This drug has several warnings from the U.S. Food and Drug Administration. Tramadol falls under the black box warnings, and this is the most serious warning from the U.S. Food and Drug Administration. It alerts patients and doctors of the potentially dangerous effects of drugs. Addiction and misuse warnings. Use of this drug can lead to addiction, which may lead to overdoses and death. To help avoid these problems, take this medication as prescribed by your doctor. If you have any concerns about this medication, talk to your doctor about it. Warnings of slow or stopped breathing. This drug may cause slow or stop breathing. If not treated quickly, this could lead to death. The risk of this increases in the first 3 days of starting the drug or increasing the dose. Incorrect ingestion warnings. If anyone takes this medicine, especially children, by accident or accident, even once, this may lead to death. Therefore, this medicine should be kept out of the reach of children. Some life-threatening effects in children. In some cases, the child's body can process this medication very quickly. But this drug causes slow breathing and death. Therefore, it should not be used by children under the age of 12. It should also not be used with those under the age of 18 years who have some risk factors, or those who have recently had a tonsillectomy or adenoids removed in the nose. Fetal opioid withdrawal syndrome warnings. If a pregnant woman uses this medicine for a long time during pregnancy, it may lead to withdrawal symptoms in the fetus, which may lead to the death of the fetus. Symptoms can include irritability, hyperactivity, unusual sleep patterns, and high-pitched crying. It can also include tremors, vomiting, diarrhea, and failure to gain weight. Warnings against taking certain medicines with it. Taking Tramadol with some other medicines can have various dangerous effects. These effects include increased levels of Tramadol, which may lead to seizures and serotonin syndrome. It also includes the decreased effectiveness of Tramadol and withdrawal symptoms. Drugs that can cause these effects include amiodarone, quinidine, erythromycin, ketoconazole, and ritonavir. Active participants with benzodiazepine can lead Tramadol with benzodiazepines and drugs, and similar to some of the serious effects of the very, which include both extreme fatigue, and slow breathing, coma, and even death. Seizure warnings. Tramadol can increase the strength of epileptic seizures. And the risk of epileptic seizures may be greater if you are taking other medicines, and these medicines include some narcotic medicines for pain relief, and certain medicines for treating depression or mood disorders. And if you take a lot of Tramadol, you may be treated with a medicine called naloxone, and this medicine also increases the risk of having seizures. Tramadol is used and how it works. Tramadol is used to treat moderate to severe pain. It can be used as part of a combination treatment in some cases, which means that you will need to take other medicines with it. Tramadol belongs to a class of drugs called opioid antagonists. It is a class of drugs that work in a similar way. These drugs are often used to treat similar conditions as well. Tramadol works by changing the way your brain feels pain. Tramadol is similar to substances in the brain called endorphins. And endorphins bind to receptors in the brain, which are parts of cells that receive certain substances. Then the receptors reduce the pain messages your body sends to your brain. Tramadol works in a similar way to reduce the amount of pain that your brain thinks you are experiencing. Tramadol side effects. Taking Tramadol tablets by mouth might cause drowsiness. Therefore, you should avoid driving after taking it, using heavy machinery or doing any other dangerous activities until you know the effect of the medicine on you. It may also cause some other side effects, the most common of which are the following: dizziness, headache, drowsiness, vomiting and nausea, constipation, weakness of the body and lack of energy, sweating, dry mouth. If these effects are mild, they may disappear within a few days or 2 weeks at most. If it is stronger or does not disappear, you should speak to your doctor or pharmacist. Tramadol may also cause some serious side effects. So call 911 immediately if you experience any serious or life-threatening side effects. These dangerous side effects and their symptoms include serotonin syndrome, which includes the following symptoms: increase in heart rate, high blood pressure, the body temperature rises to become more than normal, reactions become stronger than usual, lack of coordination, controlling your movements, vomiting and nausea, diarrhea, irritability, hallucinations, seeing or hearing things that are not real, coma, serious breathing problems, the symptoms of which may include slowed breathing rate, little chest movement with breathing, fainting, dizziness, or confusion. Physical symptoms and withdrawal symptoms upon stopping the medication, and their symptoms include the following: feeling restless or anxious and tense, trouble sleeping, hypertension, rapid breathing rate, increased heart rate, dilated pupils, eyes tear, runny nose, frequent yawning, nausea, vomiting, and loss of appetite, diarrhea and stomach cramps, sweating, shudder, muscle pain, back pain, and also joint pain, adrenal insufficiency, which symptoms may include prolonged fatigue, muscle weakness, abdominal pain, androgen deficiency, the symptoms of which include tired, sleeping problems and difficulties, poor energy in the body. You may also have seizures, or become addicted to this drug. Tramadol and drug interactions with other medications. Tramadol tablets can interact with other medications, vitamins, or herbs you may be taking. This interaction means that something changes the way the drug works. This may be harmful or prevent the medicine from working well. To avoid these interactions, the doctor must pay careful attention to the interactions of tramadol with other medicines. So you have to tell your doctor about all the medications and vitamins you are taking. Here are some of the medicines that you should not take with tramadol. Carbamazepine. Taking this condition with tramadol might decrease its pain relief. It also reduces the amount of tramadol in your body and increases the risk of seizures. There are some medicines that taking with tramadol increases the risk of side effects from these medicines. This is because the amount of these drugs may increase and cause some symptoms such as your serotonin levels may increase, and this may cause a condition called serotonin syndrome. Symptoms can include feeling agitated, restless, fast heart rate, increased body temperature, or nausea and vomiting. If you are taking one of these medicines with tramadol, your doses may need to be adjusted by your doctor. Medicines that interact with tramadol include depression medications such as sertraline, fluoxetine, paroxetine, citalopram, escitalopram, duloxetine. MAO inhibitors, such as isocarboxide or phenelzine, linezolid, lithium, St. John's wort. Headache medications such as sumatriptan, rizatriptan, or zolmitriptan. There are also some medicines that cause some symptoms when you take it with tramadol, such as exposure to slow breathing, low blood pressure, low heart rate, or confusion. And if you are taking one of the following medicines, you should contact your doctor to reduce the dose of these medicines, and these medicines include sleeping medications such as zolpidem, benzodiazepines such as alprazolam, clonazepam, diazepam, lorazepam, antipsychotic, nerve-relaxing medicines such as chlorpromazine or thioridazine, anesthetics such as pentothal, succinylcholine, propofol, There are also some other medicines that require follow-up when taken with tramadol, such as digoxin. If you are taking digoxin with tramadol, you should monitor the amount of digoxin in your body. Warfarin. If you are taking warfarin with tramadol, the doctor should monitor the amount of warfarin. They can also adjust the dose of warfarin as needed. Interactions that increase the risk of side effects from tramadol. There are some medicines that if you use them with tramadol may increase the risk of side effects of tramadol. This is because it increases the amount of tramadol in the body. Therefore, this may cause your doctor to monitor the amount of tramadol and its effect on the body more. These drugs include the following: antibiotics such as erythromycin, antifungal medicines such as voriconazole or ketoconazole, antidepressants such as amitriptyline, heart control medications such as quinidine, protease inhibitors such as atozanavir or darunavir. How should you take tramadol dosages? You must stick to the dose of tramadol as prescribed. Tramadol can slow or stop breathing, especially when starting the drug or whenever the dose is changed. Do not take this medication in large amounts or for longer than it has been prescribed for you. You should also tell your doctor if the medicine does not help you with pain. Do not give this medication to anyone, especially if they have a previous history of drug abuse or addiction. Since misuse of this medicine may cause addiction, or taking it in an overdose may cause death, especially in children or anyone else using the medicine without a prescription. You should also stop taking any other anesthetic pain reliever medicines when you start using tramadol. You can take tramadol with or without any food, but take it the same way every time. Do not crush or break the tramadol tablets, swallow the tablet whole to avoid any harm. Do not stop using tramadol suddenly, as you may experience withdrawal symptoms. Therefore, you should consult your doctor about how to safely stop taking this medicine. Throw out any tablets you have left of this medicine, as a single dose of this medicine can be fatal in someone using this medicine incorrectly. Therefore, you must get rid of your remaining medicines. Dosages for tramadol dosages. Tramadol dosage for adults, ages 18 to 64. Fast-acting tablets. Usual daily dose. The total daily dose may be increased by 50 mg. Initial dose, 50 to 100 mg every 4 to 6 hours, or as needed. Maximum dose, 400 mg per day. Extended release tablets. Typical initial dose, 100 mg per day. Your doctor may ask you to increase the dose by 100 mg every 5 days. Maximum dose, 300 mg daily. Tramadol dose for children, ages 0 to 17. Fast-acting tablets. Dosage for children 17 years, a dose starting from 50 mg and up to 200 mg daily. Starting dose, 50 mg every 4 to 6 hours daily, or as needed. Maximum dose, 400 mg daily. Child dosage age, 0 to 16 years. It is not yet known if tramadol is safe and effective for children under 17 years of age. Elderly dose, 65 years and over. The liver and kidneys of the elderly may not be as efficient with the passage of age. As a result, the drug stays in your body for a longer period and this increases the risk of side effects. If the patient is older than 75 years, the maximum dose of tramadol is 300 mg per day. But there are also some other considerations for kidney and liver patients, which are: if you have kidney disease, the daily dose is 50 to 100 mg every 12 hours of fast-acting tramadol tablets. A maximum of 200 mg daily. You should not take the extended release tablets in this case. And if you have liver disease, your dose may be 50 mg every 12 hours. Also, you should not use the extended release tablets in this case. Do not forget to consult your doctor before taking any medication to preserve your health. For any inquiries or questions, add your comment. And don't forget to subscribe and activate the notification to receive all new